I just can't move forward, Doc. I'm too scared. Hi, my name's Dr. Jesse Ritter, and in this video, I am going to cover the topic of dental fear. I'm going to talk about why it's there, what's real about the fear, what's not real about the fear, and just kind of talk about what comes up for people in conversations that I have with them when they are faced with making treatment decisions. I also want to talk about a specific patient recently that we had to navigate this fear aspect, and so I want to share her story. So I'm a transformational cosmetic dentist in Baltimore, and I have patients who we do cosmetic dentistry for that they're faced with making big decisions that can impact their life in a very profoundly positive way. But dental fear is one of those things that comes up a lot. And if we just kind of start with the sort of general dental fear that's out there, so many people are absolutely terrified of the dentist. And actually, it's probably the number one reason that people actually avoid going to see the dentist. Money is another big one, and time is a big one too. But really, fear is that thing that keeps people from making a decision that's a positive, like going and seeing their dentist and just getting their regular checkups or whatever. So fear, the thing about fear with dentistry is that there used to be a reason to fear dentistry. I mean, before the advent of modern anesthetics, dentistry was painful. Dentistry was really painful. I mean, there was a time when Novocaine even first came around where it was expensive, and a lot of dentists weren't using it, or they wanted to save money and they wouldn't use enough of it. So people have stories. I remember my gram used to she used to tell me every time I told her that I was going to, this is all through college, that I was going to be a dentist and I was going to high school, and even when I was in dental school too, she would tell the story about her dentist who, when my gram was one of 10 children, and she would always tell this story about she was at the dentist, and he was smoking cigarettes while they were in the office seeing patients. Nobody wore gloves at that time, so there's no gloves obviously, and he was an alcoholic, and so he would this kind of sets the scene for this smoky, sort of dingy office where the dentist is probably not 100% there with what's how to take care of people because he's inebriated, and he would work on her and not give her anesthetic and just drill and drill and drill, and she would scream, and this was her childhood experience, right? She would tell me this story every time I brought up dental school or that I wanted to be a dentist. And so, dental pain and the inability to take it away during procedures used to be something that was real. Now, is there still dental pain? Yes, of course there is. People get toothaches, and when people have toothaches, it's very difficult to get them numb. But anesthetics have evolved to the point where they're incredibly profound, and 99% of the time we can take away through just local injections. We can get people completely comfortable, and even the injections themselves actually can be very comfortable. There's strong topical gels that we use ahead of time. There's distraction techniques like shaking while we inject. So a lot of that fear of those things they're fear of things in the past. They're not fear of things that are real and in modern dentistry. So there is that. There's also the fear of pain surrounding the procedure. So this came up with a patient recently in the past couple weeks here, where she was up against a big decision to make a decision to really comprehensively pursue her oral health and get to a place of stability, replacing teeth, rebuilding wear, setting up her bite properly, and having the added benefit of some cosmetics. And she was ready to go. She understood everything. She wanted to move forward. She's motivated, and it came to the point where it was time to make a decision, and she went through we did a virtual consult with her. She happens to be a local patient, but we did a virtual consult, and she had time to ask questions, and we reviewed everything. But she came up, when it came to decision time, it wasn't the money, it wasn't the time, it wasn't any of that. It was fear. It was fear of pain around getting the actual work done and pain afterwards. And so she had some experiences in the past that she was drawing on, and it was the reason for her fear. And so we had a long discussion about the different ways that we can make her comfortable, help her be comfortable. She is getting treatment to the extent that she is really going to be a VIP in our office. So she's actually going to be the only patient in our office when we are doing her treatment. So she's going to be fully comfortable. There's going to be nobody else around. We're actually going to give her some medication beforehand to relax her, and of course then use the most profound anesthetics that are made. And so we sort of talked about that and making her comfortable during the appointment, and she came to understand, like, yes, okay. The second thing we had to overcome, though, was her fear of pain after the fact. And so she was drawing on an experience in the past where she had a crown done, and she had a lot of sensitivity afterwards. And we sort of talked about the fact that when you have a crown done, a lot of times, not all the time, there's a significant amount of tooth structure that has to be removed. And most of the teeth that we were going to be doing restorative dentistry for were veneers, and those veneers and composite, but most of those are going to be very conservatively prepped. And so anytime we're doing a big case like this, we get a 3D blueprint made up front. And you think, why do we do that? Well, if you get a house made, you don't just have a contractor come out and they start building. You get blueprints drawn, and you revise those blueprints, and you approve those blueprints. A smile is no different. So we get a blueprint done ahead of time. The other, just for planning purposes, the other benefit of doing a blueprint is that when it comes time to actually prepare the teeth, we are using that final shape of the teeth, where we are going, that blueprint in 3D, and we're using that to guide so that we only cut on teeth or roughen teeth in the precise areas where they need to be reduced. There's not just blind going in there, let's grind them down to nubbins, and then let's put crowns or veneers on them. It is very controlled, it's very precise, and it's very much dictated by the final outcome we're trying to achieve. So we talked a lot in detail about that, and the fact that, again, after the appointment. So let me go back just a little bit here. Post-operative sensitivity and discomfort, a lot of times that's dependent on the amount of the aggressiveness of tooth structure removal. And so if we can be ultra conservative with that, there's going to be less sensitivity, less discomfort after the appointment. Okay, so the second thing is that we have medications, both over the counter and prescription, that really, if you're really struggling for a couple days for whatever reason, which is pretty rare after like a veneer appointment, we have medications to control that discomfort. So ibuprofen and Tylenol alternating every 3 hours, that actually, studies have shown that is as strong as using Vicodin, regular strength Vicodin. And so that gets like 99% of people, if they're having some discomfort after the fact, that combination gets them comfortable. So we reviewed these things, all these kind of tools we have at our disposal, talked about how modern dentistry really does not have to be super aggressive with tooth reduction, and she came to realize that, you know what, I can do this. And so it was it's one of those moments where a limiting belief or a false belief or a fear was really holding her back, and we really had to dive deep into that to get to a place where she could say yes to being healthy, which is something that she wanted and desired to do. So she's going to go through the Smile Solutions experience. So a lot of fun. If you are curious about the Smile Solutions experience, I would love for you to reach out to me. You can reach out to me directly, or the other thing you can do is visit the link, click on the link, and it'll take you to a video that is all on the Smile Solutions experience. It lays out all the appointments and how they work. And I think that might be something that if you're interested in just learning more, that you might find useful. So, again, my name's Dr. Jesse Ritter, signing off for now. Until next time.